Good day everyone. This video will discuss the house rules for mandatory or stringent quarantine facilities as part of quarantine requirement of the Bureau of Quarantine under the Department of Health of the Republic of the Philippines. Reminder: this is a public health advisory. Your compliance is mandatory. But before that, let us understand again what is Covid-19. Coronavirus disease 2019 is a contagious disease caused by severe acute respiratory syndrome coronavirus 2. The first known case was identified in Wuhan, China in December 2019. The disease has since spread worldwide, leading to an ongoing pandemic. Symptoms of Covid-19 are variable, but often include fever, cough, headache, fatigue, breathing difficulties, and loss of smell and taste. Symptoms may begin 1 to 14 days after exposure to the virus. At least a third of people who are infected do not develop noticeable symptoms. Of those people who develop noticeable symptoms enough to be classed as patients, most, 81%, develop mild to moderate symptoms, up to mild pneumonia, while 14% develop severe symptoms, dyspnea, hypoxia, or more than 50% lung involvement on imaging, and 5% suffer critical symptoms, respiratory failure, shock, or multi-organ dysfunction. Older people are at a higher risk of developing severe symptoms. Some people continue to experience a range of effects: long COVID, 4 months after recovery, and damage to organs has been observed. Multi-year studies are underway to further investigate the long-term effects of the disease. Transmission of Covid-19 occurs when people are exposed to virus containing respiratory droplets and airborne particles exhaled by an infected person. Those particles may be inhaled or may reach the mouth, nose, or eyes of a person through touching or direct deposition, like being coughed on. The risk of infection is highest when people are in close proximity for a long time, but particles can be inhaled over longer distances, particularly indoors in poorly ventilated and crowded spaces. In those conditions, small particles can remain suspended in the air for minutes to hours. Touching a contaminated surface or object may lead to infection, although this does not contribute substantially to transmission. People who are infected can transmit the virus to another person up to 2 days before they themselves show symptoms, as can people who do not experience symptoms. People remain infectious for up to 10 days after the onset of symptoms in moderate cases and up to 20 days in severe cases. Several testing methods have been developed to diagnose the disease. The standard diagnostic method is by detection of the virus nucleic acid by real-time reverse transcription polymerase chain reaction, RRT, PCR, transcription-mediated amplification, TMA, or by reverse transcription loop-mediated isothermal amplification, RT, LAMP, from a nasopharyngeal swab. Preventive measures include physical or social distancing, quarantining, ventilation of indoor spaces, covering coughs and sneezes, hand washing, and keeping unwashed hands away from the face. The use of face masks or coverings has been recommended in public settings to minimize the risk of transmissions. Several vaccines have been developed and many countries have initiated mass vaccination campaigns. Although work is underway to develop drugs that inhibit the virus, the primary treatment is symptomatic. Management involves the treatment of symptoms, supportive care, isolation, and experimental measures. Now, going back to the house rules in the Philippines set by the Bureau of Quarantine. House Rule Number 1. You are considered a person under quarantine or PUQ and shall be assigned to one room each, care of Overseas Workers Welfare Administration, or licensed manning agency, or private individual. Room sharing is not allowed at all times. Room sharing for families with minors and persons needing assistance shall be pre-approved by Bureau of Quarantine prior to arrival at the airport. Number 2. Strictly practice minimum health standards. This includes wearing of face mask and face shield, maintaining physical distancing, frequent hand washing, avoiding touching the face, and observing cough etiquette. Number 3. No contact policy upon check-in and check-out or discharge of repatriates except for persons needing special assistance like pregnant, infants, handicapped, and elderly more than 70 years old. Number 4. Strictly stay inside your room for your protection and prevention of contamination from other repatriates. Number 5. In the event that master key is not available, all key cards or room keys shall be surrendered to the hotel staff. Number 6. Do not use the double lock in your respective room at all times. Number 7. Hygiene kits, personal household kits and other approved or essential grocery items shall be provided by OWWA, or LMA, or hotel staff. Number 8. Social gatherings including visit to other rooms and receiving visitors is not allowed at all times. Number 9. Physical conversation with fellow repatriates and hotel or quarantine facility staff is not allowed at all times. Number 10. Individual physical and mental exercise inside your rooms to stay healthy are encouraged. Number 11. Wi-Fi access shall be provided in the entire compound. Number 12. CCTVs are positioned in strategic areas. Number 13. All PUQs will be monitored remotely via laptops, tablets, cell phones, or hotel intercom or telephone. Number 14. When physical examination is necessary, for persons with symptoms, the concerned must wear face mask, fully open their door, and present themselves for physical checkup. Number 15. Inform OWWA, LMA, or hotel staff through intercom or phone for the development of signs and symptoms such as fever, cough, colds, sore throat, and diarrhea, among others. Number 16. Notify OWWA, LMA, or hotel staff through intercom or cell phones for the exacerbation of pre-existing medical condition like hypertension, diabetes, and heart diseases and request for medicines care of OWWA or manning agency when needed. Ensure intake of maintenance medication. Number 17. Inform OWWA, LMA, or hotel staff for any food restrictions, allergies, and other special needs like halal. Number 18. Meals will be placed at your doorstep every 6 to 7 in the morning, 12 to 1 noontime, and 6 to 7 in the evening. Snacks shall be provided. This may change depending on the structural setup of the hotel. Number 19. Deliveries of any item in and out of the hotel is prohibited, except for health-related items such as medicines and medical equipment. Outside foods such as grab food, online food deliveries, and food from relatives are not allowed. Number 20. Smoking cigarettes, vaping, and drinking of alcoholic beverages is not allowed at all times. Number 21. Access to public amenities like swimming pool, gym, spa, and gaming areas is not allowed at all times. Number 22. All garbage and trash should be placed inside properly sealed yellow trash bags provided in each room. This must be placed at the anteroom or underneath the table or chair outside the room and will be collected 2 to 3 times a day. Number 23. Housekeeping shall not be provided by hotel staff because you are on quarantine and may potentially spread infection. You shall maintain cleanliness of your room at all times. Number 24. Laundry and drying will be your responsibility and to be conducted inside your rooms. Laundry supplies care of the Department of Tourism, OWWA, or LMA. Number 25. Linens are prepositioned in your respective rooms. Clean linens must be provided every 3 to 4 days or as needed for soil age. Unused linen will be collected at the end of the quarantine period. Number 26. Media interview and posting in social media is not allowed. Electronic gadgets and cell phones of those who violate this will be confiscated and will be returned after the quarantine period. Number 27. In case of emergencies like occurrence of fire and earthquake, please follow the designated evacuation leaders and signages. Number 28. During extraction of positive repatriates, BOQ conduction team will wait at the vehicle, hotel staff shall assist the repatriates. Number 29. For on-signer seafarers who tests positive for their RT-PCR test, manning or hotel should inform local government unit of the city or municipal health office for extraction or appropriate action. Number 30. Hotel will provide or designate swabbing room or area. Patients with signs and symptoms should be swabbed at their respective rooms. Number 31. Additional measures imposed by OWWA or LMA as approved by BOQ, must be followed. Number 32. For your logistical and other concerns, for OFWs, please contact OWWA. For non-OFWs and returning Filipinos, please contact the Department of Tourism or hotel staff, and, For seafarers, please contact your local manning agency. These are the guidelines for strict compliance. Thank you very much. Keep safe. Keep healthy. God bless us all.